how, collectively as a group, as individuals, whether in our group practices, in the classroom, in the boardroom, what can we do to kind of be ready, for some of this policy change coming our way?
Tonight we're going to focus on the potential impact of Trump administration policy on healthcare, with a special focus on primary care writ large, starting with the impact of implementing a major Trump campaign and Republican promise, which is to repeal and to replace the Affordable Care Act. As you all are well aware, the Trump administration has begun to implement campaign promises in many arenas, including policies on immigration and refugees, education and the environment, all critical, all of concern, and frankly, all posing a potential threat to public and population health.
While coverage doesn't guarantee access, and it doesn't guarantee good health, and it doesn't guarantee, access to reproductive health services or mental health services or substance abuse services, without it, we don't have a starting point. So I take the position that it is the foundation for everything else we do. And it's at incredible risk. Just as a reminder, what expansion did is it provided states with the money, almost 100% federal dollars, a federal matching rate, to expand their Medicaid programs to all adults with incomes up to 138% of the federal poverty level. So it changed the landscape nationally dramatically. And I will tell you that some of the repeal bills, and the repeal bill the one reconciliation bill, which is how we're going to repeal it, that passed in 15 and was vetoed by President Obama in 16, not only repealed the expansion, but repealed the authority to expand to childless adults and parents above the prior income levels. So how are they going to repeal? They're going to do it through reconciliation, because that makes it filibuster-proof. So they only need 51 votes. It will probably happen in February or early March. And again, they won't make it effective immediately. It will be effective in 2 or 3 years. What happens in the interim? What happens when it goes into effect? Do we still have authority? And will that $72 billion be in our base? Or will, under the rules, budget rules in Congress, is it removed? Congressman Paul Ryan and HHS Secretary nominee Price are committed to moving Medicaid to a fixed funding scheme, a capped funding, either through block grants or per capita caps. All of the block grant proposals and per cap proposals reduce the federal dollars and cap it. That is the goal. The only proposal that CBO could model out found that we would lose, states would lose over 10 years, $1 trillion.
We're at this sort of juncture in time where I think between, the ACA, the Mental Health Parity Act, and this latest round of the 21st Century Cures Act has really sort of put behavioral health front and center and really allowed parity to be part and parcel of what everyone expects, right? So my concern around all these issues and how the states and the feds are going to sort of jockey around what's going to happen next is worrisome, in that for the first time, I think, coverage has been expanded. More people that need benefits are getting benefits that include, as part of an essential package, mental health, substance use. And to roll that back at this juncture is incredibly worrisome and just detrimental to, I think, where we want to go in terms of ultimately achieving, the outcomes we want. And as a psychiatrist on the panel, I have to say that whether we talk about primary care and the impact that behavioral health conditions, have, or the impact that they have on the cost or the direct cost that they have, is hugely important. And we sometimes lose sight of those conversations when we're thinking about how do we fix a system of care where we don't really focus in on the behavioral health aspects, whether it's the mental health or the substance use conditions. And that gets lost in the numbers, gets lost in the policy debates around these issues.
I think there are three main issues that we need to be thinking about right now. One is contraceptive coverage, that's already been touched on a little bit. One is safety net care, which has also been alluded to at least, and abortion. Right now, 55 million women are covered by the ACA's contraceptive coverage guarantee. So what that has done is allowed tens of millions of women to access the right form of birth control that works for them and that works for their family. The new administration is poised to make dramatic changes to the nationwide network of publicly funded healthcare centers. Millions of women rely on these centers for contraceptive care, as well as other services like testing and treatment for sexually transmitted infections. And in many cases, and this is critical, 4 out of 10, specifically, this safety net care is the entry point for those women into healthcare, and it is the only form of regular healthcare that they get. I think what we'll see now is the introduction of several federal restrictions along the same lines, attacking abortion at all sides.
The obvious, this discussion is a tiny part of a huge national debate with enormous impact on millions of Americans who are on the line. 2 issues. One are our values, and the other is our money. And the value question is, are we committed or not to assure and provide care to everyone? And I think for all of us, there's only one answer, but that's in doubt now. And as far as money goes, I think the question is public policy all about controlling how much money government spends on health care, or is it to be directed to bring health care costs generally into line with other developed nations? You've heard about block grants, yet another reason for concern. How will block grants be distributed? Will it all go to hospitals? And then there's also 340B, which is a related issue attacked in part, most of all, by guess who? The pharmaceutical manufacturers who don't want their profits eroded by sharing it with safety net providers. So there's reason for hope, I think. Community health centers have been one of the very few areas of consensus between Democrats and Republicans over the decades. And this could be one place for Democrats and Republicans to show that they can work together and climb the cliff, among other responsibilities. And wouldn't it be nice to think that that could be the basis for a larger discussion then extending to other aspects of healthcare policy?
And, just want to congratulate PCDC and hope they continue to do the great things that they do. Many of our FQHCs, of course, would not be around without the special work that PCDC is engaged in and does for them and for so many other people. So, like everyone else, when PCDC sends out an invitation, we always want to be here. It's always good stuff, good for the community, good for our members, good for our partners, and good for ourselves.